Change was founded in 2017, and it's a joint venture between Change and McKesson's IT. Talk about the area that you are in, which is a hot area these days. It's data analytics, consulting, health IT.
It's really taking the scale of a company like ours and their 30,000 customers, 700 channel partners, really a ubiquitous presence embedded in U.S. healthcare, and taking that data and helping payers, providers, consumers be more effective and improve the efficiency of healthcare.
One of the things that people have talked about is price transparency. In fact, this week, the White House saying they want to push for that and actually require both hospitals and doctors, the providers, as they're known in the business, and the payers and the insurance to give consumers their actual net cost of what a lot of things, whether it's surgery or services, will cost them. That's an area that you all work in. Do you see that as an opportunity, this mandate coming forward?
Well, we've been very supportive of improving price and cost transparency and helping consumers be better healthcare shoppers. We think it's important, though, that it's done with the right emphasis also on the quality of care and doing it in conjunction with the providers and the payers who have this deep experience in the industry. So it's something that's important, something we support, and something we're working with all our customers on.
How are your customers navigating all of the rhetoric in terms of potential changes? Last night we had the Democratic presidential candidates talking about, and some of the frontrunners are saying they would like to wipe out private insurance, which would certainly be a wholesale change. Is this something that you talk about with your customers, and how would that impact your business?
Well, it's important, I think, when you look at all the plans that everyone's talking about, these all focus, I think, on three things: improving access to health care for all Americans, reducing the cost of the system, and also looking at a way that we can actually pay more on quality and not so much just on activity. And that's really something that we've focused on with our customers for many years. So no matter what reimbursement changes, and we've seen quite a few even in the last 5 years, we think we're well positioned to help our customers do well in any of those environments.
But is it causing caution in the business environment and investment, given that we are seeing so much rhetoric about wholesale change? Certainly we've seen it in the equity markets. The healthcare sector has been under pressure since we've heard so much talk about regulation, whether it's drug prices or in terms of changing the way our insurance markets work.
I think it's causing the industry to look at companies like ourselves that can provide them the kind of data and information to have more of these data-driven decisions to optimize how they operate under any circumstances. The understanding of being more flexible and more agile, depending on where healthcare is going, I think is a priority for all our customers from what we see.
A lot of your customers are insurers. You also have hospitals as well. Do you find it being an advantage being a standalone company that provides these data analytics? A lot of your competitors are the likes of United Health or Cigna or CVS, which are within vertically integrated firms.
Well, I think our independence, but frankly, Bertha, also our scale, 30,000 customers, 700 channel partners. We really have a view of the U.S. healthcare system, are embedded in it in a way that's really unprecedented in U.S. healthcare.
And talk about the process of coming public here. Obviously, you're an established company. It's not like a startup coming public, but has the market been receptive?
Very much so. I mean, given the scale that we have and the fact that we now have far more digitized clinical data in the country, working through all the ways that you can take that and use it effectively on behalf of payers and providers, we've been very excited by the investors who have believed in our vision and become investors in Change Healthcare.